Hey everyone, I'm Randa Bain. I'm a senior investigator at PERL, working on the politics of preparedness. So as we've been hearing earlier, evidence is really essential for addressing pandemics and crises, but it's insufficient for policy action. Here at PERL, we're committed to investigating the politics aspects in terms of how preparedness is shaped by power relations, by financial planning, and by competing political priorities rather than solely by epidemiological risk. One of our ongoing projects looks at the extent to which preparedness measures, especially related to influenza and coronaviruses, are prioritized, and to understand their implications for equity, accountability, and the capacity to respond effectively to future pandemics. So this panel will be discussing the political dynamics shaping preparedness. And I'm delighted to have a number of incredible experts to discuss this important topic. So we have Fatima Hassan joining us online from South Africa. She's a human rights lawyer, founder of the Health Justice Initiative in response to the inequities of the COVID-19 pandemic. Oh, there she is.
Jumping right into that.
Okay. And is an expert in global health access. Roojin Habibi is an assistant professor at Canada's University of Ottawa's Faculty of Law, advised the WHO on international health regulations amendments, and is a global health, law, and human rights scholar, including on pandemic preparedness. Nina Schwalbe is the US-based founder of Spark Street Advisors, has held leading roles at Gavi, UNICEF, and as director of USAID's COVID-19 Vaccine Access and Delivery Initiative. She's now running for Congress in her hometown of New York, so watch this space. And then our moderator, Jennifer Welsh, is the director of McGill's Max Bell School of Public Policy, co-founder of the Oxford Institute for Ethics, Law and Armed Conflict, and former special advisor to the UN Secretary General on the responsibility to protect. So, over to you, Jennifer.
Great. I hope this is on. Yes, it is. So can I just say that I think this is like one of my top 5 days at McGill. I'm so excited by what PERL is doing, and I want to just salute my colleagues, Joanne, Prativa, and her entire team. It's wonderful to be part of such an energizing event. And I also need to give you a health warning, and that is that I'm a political scientist. So that last panel that was all about how important politics are is kind of my bread and butter. I was sitting there going, Of course, it's about politics. So this is what this panel is about. That preparedness isn't just a technical issue. And I encountered some of the political dynamics around pandemic preparedness and response in work that I co-led about 3 or 4 years ago, including in collaboration with Paul Wise for the American Academy of Arts and Sciences post-COVID. And we were trying to really pinpoint the factors that limited meaningful international cooperation during the pandemic. And by that, I don't mean cooperation among scientists. I mean cooperation among member states of the United Nations system. And so we saw that some of the political factors had to do with issues like sovereignty, which challenged the need for transparency and investment in global public goods. The politics that can kind of hamper collective action. Other political issues had to do with a recurring tension in global governance between those that advocate for the importance of innovation at all cost and those that portray pandemic preparedness and response as a matter of solidarity, right? So different political agendas. But of course, beyond the international politics of preparedness are domestic political dynamics. And these are often pitched as trade-offs between short and long-term priorities. Immediate crises always garner the most attention. Between the role of different levels of government, something we know just a little bit about in Canada, right? Federal, provincial politics. And and tensions between the broadest protection possible and what is claimed to be feasible. So what's fascinating about the last panel was a discussion about countries that did well and countries that did less well. And as a social scientist, we love variation, right? We love variation. We want to explain variation. And a lot of it has to do with politics, political choices and decisions. So our task on this panel is to bring that inescapable truth about pandemic preparedness to the table and to discuss this from a variety of perspectives. So Fatima, who will join us online, will bring a health justice perspective on power and access. Roojin will unpack the legal and governance architecture shaping pandemic preparedness and response. And Nina will focus on what it takes to finance, measure, and operationalize preparedness, particularly as it's set out in the new pandemic treaty. But before we do all that, we have another Mentimeter. So we need to ask you a question. What's our question? I'm really excited to find out. Do you think it's fair for a low and middle income country to notify the world about a new virus but not have access to vaccines once available? Right, a critical question. So there's your Mentimeter question. Sorry. Nina doesn't have a view on this. No, she has no view on this. So I'm going to start. Should I wait for this to kind of load up? Okay, I'll wait for 20 seconds. It's very hard for me to be patient. We getting there? It seems like we have a big leaning towards it's not fair. And it's interesting, the word is fairness. Fairness is also important, not just trust, right? Perceptions of fairness sometimes breed trust. Okay, great. So I'm going to start off our panel by giving each of the panelists 4 to 5 minutes to answer some preliminary questions of mine. And then we will go to another round, which might be quicker. And then we'll open it up to you. So Fatma, I don't see you. I hope she's coming back. So Fatma, you can hear me, I hope. Your organization's mission, you can hear me. Yes?
Can you hear me?
We can.
Hi, everyone.
Your organization's mission is to understand and address the factors that shape health inequities primarily in the global south. Can you share with us what you believe to be some of those key factors and the political and commercial dynamics at the heart of them, particularly as they relate to health-related crises? Over to you.
Thanks. So it's just so great to be on this panel with some colleagues that I've always admired your work. So really excited to be here, and also congrats to the team that set up the center. I think it's more important than ever, particularly I think in the current geopolitical polycrisis that we're facing, that Canada steps up and its academics and researchers also begin to play a very different role. So I had a few remarks, but your question just triggered me, because I think there's a second part to the question that you've asked the audience, and that is, and should that country then be slapped with a travel ban, right?
Yep.
After sharing the data, not having vaccine supplies, and then slapped with a travel ban, preventing all of us from participating in important meetings around the world, but not banning other countries with a similar outbreak. I think we're all talking about Omicron. And that happened to South Africa. So this question is actually a real example of what happened to South Africa when we shared data on the Omicron strand during COVID. And so that's why it's a bit triggering for us, because this is what happened in December of 2021. So I just wanted to start off by reflecting on some of the issues that occurred in COVID, that just being one example. The other characteristic that was basically an ugly, I would call it an ugly feature of COVID, was just the inequity in access to vaccine supplies as well as other technologies. As you all know, the Global South was basically deliberately left behind. And I think that we're seeing that the way in which the pandemic treaty negotiations are playing out, as well as sort of the discussions around the annexure to PABs. And I say, I use the word deliberately very consciously, because I think it was a strategy of global North countries to overorder, to basically take up global supplies, to not share technology when they could have, to not allow multiple vaccine manufacturers into the system, and to drip feed us with small batches of supplies. Because basically, and I think, the elephant in the room is that the systemic or political reason for the reason why Global South people are devalued and our lives are devalued is because of racism. Right. So I think racism is a key systemic factor in the way in which global health is playing out, and the global health architecture is playing out. And honestly, I think that global North leaders very often do not really care about the lives of people in the global South. We saw that in the AIDS crisis. We saw that in COVID crisis. We saw that with the Ebola outbreak. And we're currently seeing it with the way in which the global rollout of a key HIV prevention tool called lenacapavir is being prioritized or not being prioritized. The same story of not sharing enough doses, not sharing technology, not sharing data, and not introducing new supplies into the system. So we know all the lessons. We've learned the lessons. We don't want to apply the logic of those lessons to current health crisis. And I think that's playing out in these international negotiations. But I think the key systemic barrier to why people in the global South are mostly left behind, why there isn't a greater sharing of data, science, technology, is the commodification that has taken place in the last 2 decades of life-saving technologies, including vaccines, therapeutics, diagnostics. And I would also include now the commodification of data, including surveillance information. And that has to do with intellectual property rules. And so you often, if you've heard me before, I'll talk about this till I'm blue in the face, but intellectual property rules, which are currently embedded in the TRIPS agreement, which resides at the WTO, is one of the key reasons why we don't have timely access to life-saving tools and technologies. So I'm not talking about cars, and I'm not talking about perfumes, and I'm not talking about jewelry. I'm talking about life-saving diagnostics, life-saving vaccines. We saw that with AIDS. We saw that with COVID. We're seeing that again. And the problem with the commodification of medicines, and including all medical technologies here, is that we've allowed, by we I mean the pharmaceutical sector and governments in the global North, have enabled and allowed a system where you reward innovation with a minimum of a 20-year patent term, which basically gives you a monopoly, and that monopoly allows you to do 2 things. And I think people often only think of the first thing, which is about setting price. It's more than just about setting price. You shape markets, you shape global markets. We saw that playing out in COVID. You determine the pace at which generics can come in, and you determine the pace at which price reductions can occur. And we're seeing that playing out with TB treatment, life-saving TB treatment, diagnostics as well. So it's not just limited to, I think, HIV and COVID and Ebola. There's many diseases for many decades that we can talk about how IP became the stranglehold and the barrier to the global South getting access to something that could save lives in a timely manner. Now, the thing that happened in COVID is we eventually got the vaccines, but we got them a year and 18 months and 24 months later. So while you were getting your second shot because your government over-ordered and then was hoarding vaccines, we were still waiting for our first shot. Many of you supported us in our efforts to call for global solidarity. So this is not a critique of academia or researchers or the activists in Canada, but it is a critique of the way in which your government, as well as governments in the EU and the US, behaved. Now, I'm singling out Canada, the EU, and the US because another systemic barrier is the three blocks, right? It's the way in which the US behaves. It's the way in which the EU behaved during COVID as well, the way they blocked the waiver. We can talk about that later, where there was an attempt to try and suspend some of the global IP rules during the time of a pandemic. And so that's why when we come later to the session about the definition of a pandemic, the timing of a declaration, these are all important instruments that are embedded in the current set of documents and negotiations, which potentially could have a benefit for people in the global South. But if it plays out in any way the way it did during COVID, then I'm sorry, but all of us are going to just wait for papers and documents, and ultimately solidarity will just be a word. So the final systemic barrier, I think, is political leadership, political desire to support a global system of international rules. I think currently that is being dismantled. If you look at the way in which the genocide is playing out, if you look at the way in which the US government picks and chooses which laws it wishes to support and which laws it wishes to observe, similarly the EU. And so I think the decision by the US to basically exit the WHO obviously has an implications for how we're going to deal with some of these global health inequities going forward. I see you holding your mic, so I think that means my time is up. Thanks.
I will come back to you. Do not worry, particularly to pick up on your last point. Thank you so much for that really concise delineation of some of the systemic factors that you think explain the way that these infectious disease with pandemic potential play out in the global South. Roojin, I want to come to you next because we know that, in fact, during COVID, but certainly after, we had a host of blue ribbon panels. Our friend and colleague Joanne was part of one of them that tried to do a diagnostic on what went wrong in terms of international cooperation. And some of those panels recommended significant structural changes, including to the WTO, but beyond that as well, and called for a new legal instrument. So I would say that there was another response that encouraged us to look instead at the instrument that we had, which was the International Health Regulations revised in 2005. And some took the view, hey, we've got an instrument, what's lacking is states' compliance. So let's focus there rather than try to engage in the very difficult politics of negotiation on a new multilateral instrument. So I wanted to just get your view first on what the best path of reform was in the immediate aftermath of the pandemic. Of course, hindsight is 2020. But also elaborate for us on the nature of progress on amendments to the IHR that have happened since the pandemic. What are some of the key political dynamics there? Try, and otherwise you can use mine.
Now it's on. Okay. Yes, I think it's on now. Wonderful. Well, thank you so much, Professor Welch, for the really fantastic questions, probing questions, and I also want to just join the chorus to congratulate Joanne Liu, Prativa Baral, and all the team that's been involved in getting this event set up. What an honor to be here, and what a fantastic initiative you guys have started. It's really inspiring. Just really kudos. So I guess I'll start off my interventions by bringing into this discussion a lens that I had. You often talk about being in the room where it happens, and while I wasn't in the room for the duration of many of the negotiations that happened, I was, as Miranda had read out on my bio, I was involved as an expert who was providing input to member states of the World Health Organization on amending the international health regulations. And in the wake of COVID, there was, of course, 300 proposed amendments. You may have known that the initial resolution that opened up the amendment process had asked for targeted amendments to the international health regulations, and then we saw 300 proposed amendments taking the international health regulations really in so many different offshoots and directions. So it was a sea change potentially for the international health regulations. Now, as part of that committee, we really had many lawyers in the room, but we also had public health experts, epidemiologists, and others. And it was an excellent opportunity to be in that interdisciplinary space, but beyond engaging in the text of the international health regulations, we really had to take a step back and ask ourselves, what does it mean to bear witness to the toll that COVID-19 had taken on lives and livelihoods around the world, and to still adhere to this view of the international health regulations as a technical instrument? So I want to just take a step back, because not everybody in the room might be fully aware of what the international health regulations are. So I want to take a step back just to give you a very quick segue or 101 into why they were always viewed as a technical instrument. The international health regulations are the world's oldest international treaty on public health emergency prevention, preparedness, and response. It's the only one at the moment, but we now have a pandemic accord in the works. But what makes it so interesting is that it's one of those areas, public health is one of those areas where international law has seen cooperation since before the United Nations. So it's a very old instrument. It comes with a lot of baggage as well, but it also has this DNA to it, right? It's a DNA that is about, this is the area where there's public health expertise and engagement, and it's a technical instrument. We have to view it as such. What's interesting about the international health regulations as it is now adopted under the World Health Organization when the WHO was established is that it was adopted as an opt-out instrument. So that means that states are automatically bound by the changes to the international health regulations after a period of time elapses if they don't opt out. That's really unusual for international law, because in international law, sovereignty is primordial. And states should be able to always say, no, it's like a subscription, right? You're automatically renewed. And when you're automatically renewed and you never wanted to be bound by it, you might be a bit frustrated by that. But that's the quirk of the international health regulations. So now when you're thinking about what happened in COVID, right? And you're thinking to expand the international health regulations and to revise it, and you see all these amendments having to do with a full slate of issues that deal with access to resources, distributive justice. Some recoil by that because they think, wow, this is changing an instrument that has technical importance into a political instrument. But some will also say, but that's the world in which we live, and we have to accept and embrace that and move the international health regulations in that direction. And so that's the issue that we were grappling with. And in particular, we were grappling with concepts like equity and solidarity being integrated as new guiding principles to the international health regulations. And in the end, if you read the committee's report, we decided that we should go in that direction. But that is not enough. And I think this is where it's really wonderful that we have someone who is an expert on the structural inequalities that we witnessed during COVID-19, like Fatima Hassan, with us today. It is, of course, not enough. But what I've also argued with regards to the international health regulations is that that sets a floor beneath which we cannot anymore go with the international health regulations. From here on out, as we move forward, amendments and changes to that instrument will have to grapple with equity and solidarity. And international law changes in a 2 steps forward, 1 step back fashion. It doesn't always change, and it doesn't do linear, there's no linear change either, right? It changes in ways that you don't think. It sometimes disappoints you, and then sometimes there's a big win. So the Pandemic Accord, which I won't talk to a whole lot because I know we have another expert in the room with us today who will grapple with that a lot more. But the Pandemic Accord tries to deal with the life cycle issues, the structural issues that come through with the that we saw during COVID. Issues around technology transfer, issues around supply chain of access to medicines, and so on. So we need both instruments, but what's interesting about the international health regulations was the fact that it was this old instrument, the DNA of which was irrevocably changed. We've changed what the international health regulations is about. It's no longer a technical instrument about cooperation on ports of entry. It is an instrument that has to do with resource inequalities. It is an instrument that empowers the WHO to engage in facilitating access to medicines. And from here on out, that is the international legal agreement we have. I think we'll talk about the Canada point later, so I'll stop there. Yeah.
Thank you so much for that, and a really nice building on Fatima. And you know, it strikes me that this is, I don't think this moment has been fully appreciated, that at a time when I think we're seeing in other multilateral discussions, the call to become, to return to basics, to not try to be too ambitious with forms of international cooperation because we don't have enough consensus, that here we have an instrument that is trying to become more political, dare I say even almost more normative in talking about issues of equity and justice. So let me finally bring in Nina. and I realized it was, I said to her before we started, she was the Nina I was reading while I was following the negotiations on the pandemic treaty, and I just put two and two together. Because those negotiations were very long, very difficult. Joanne's nodding her head because we were following them for a long time. But we did see success in 2024 with the new agreement on a pandemic accord. So can you give us a sense, Nina, of the key political divisions that played out in those negotiations? Fatima has alluded to some of those already. What were the really key political fault lines? And what was left unfinished? Where the most intense negotiations are likely to be now as we try to finish the process.
Great. Merci à tous. Ça marche? Oui, ça marche.
Non, non. Ça va maintenant?
Ça marche pas? Ah, bon. Merci à tous. Je suis très heureuse d'être ici avec vous et merci à Joanne et toute l'équipe pour l'invitation à être ici. Merci bien. Je vais parler en anglais. And I also wanted to acknowledge the indigenous lands on which we sit, and thank you for that introduction. Before I get to the question, I want to respond to something that Fatima said, which is that we did it equally badly, Fatima, in my own city of New York. I mean, Black and brown people didn't do great in terms of vaccine distribution. In New York City, my home, we lost 45,000 people. And I say that every time because I just want you to think about that number. We lost 45,000 people in New York City from COVID-19. And rich area codes in New York were vaccinated, all ages before older people, people of color, low-income people in other districts, high-risk people were vaccinated. So I just want to say that inequity is, in case you missed it, inequity is alive and well in the United States of America. Now to the treaty. So we saw a lot of, I started working on the treaty in the beginning. It sounded like a super cool idea to work on, like, hey, let's work together better next time. And the way that it was explained to us at the time is, you guys are the technical people, the IHR, but we need a better way to work together that's fair. And Joanne and her crowd did a lot of work on this about saying it had to be head of state, it had to be multi-sectoral, it had to be all of government, and it should be negotiated in New York City. And the reason why it should be negotiated in New York City isn't because that's the greatest city in the world, Montreal aside, but because that's where the UN sits. And Joanne and Helen Clark and Christine McNabb and others, honorable Canadians, said, we have to take it out of health because pandemics are multi-sectoral, and we have to think about education, and we have to think about trade, and we have to think about borders, and all these other things. And so the first battle we lost, I would say, of the pandemic treaty crew, and there's a shout out to Yasan, also, who's one of the COVID pandemic treaty warriors in the room here today, and I guess also at McGill, was that we lost the battle as that was in New York. It was not in New York, it was negotiated in Geneva. And then it became already a capture of health. And that's where also it got a little confusing with stepping on the toes of the IHR. And we saw a lot of political solidarity, I would say, but we also saw divides. And the divides, since you asked me about those, aren't things that are unimaginable. We saw North and South. We saw manufacturing countries and non-manufacturing countries. We saw groups like the anti-sanctions group. For those of you that do work at the UN, there's always a group of countries that come together and say sanctions are unfair. So we saw some of the political dynamics play out in their political normal ways. The CANs, that was something I'd learned. I never knew that before. Canada, Australia, New Zealand, the CANs countries. The Quad, all these things played out. But what was unbelievably great about what played out is we had a group of equity. And the group of equity was a wide range of countries across all continents that came and said, we have to do this better next time, mostly low and middle income countries, but also middle income countries, so not only low income countries. And then Africa came together as one continent. And I think it was the first time in negotiations of this level where the whole continent, north to south, came together as one negotiating bloc. And that was very positive because they stood strong. I think your second question was about what's unfinished, or what are the tricky parts?
And where will the negotiations go? How difficult will they be?
Yeah, so we're stuck in the middle of, back in the middle again, I think. We're stuck back in the middle again. There was great progress. There was a push through last year to adopt this pandemic treaty. And again, the idea of the treaty is we can work better in our silos, but we also need to work better with one another. So it was dealing with equity, vaccines, how we deal with data, how we deal with money. But so the fortunate and great part is that was passed last year by the World Health Assembly, except for one part. And the one part that wasn't passed was what's called pathogen access and benefit sharing. And that gets to exactly what Fatima was talking about. That's the part about what do we do with the stuff next time it happens. And that's the one part that they couldn't get to agreement last year. So there's been a process this year that they're almost done with. They have 10 negotiating days left to try to get agreement on if country X gives data or pathogenic data, what do they get in return? And unfortunately, this is still absolutely stuck.
And that's where we are. Yes. And for those of you who study this, it will always be PABs in your notes, right? The pathogen access and benefit sharing. So it's great to have both of you speak to the different legal instruments. This key point about the equity group, I think, is worth elevating. And I remember I was following the negotiations and saw, I believe it was a letter from Cyril Ramaphosa at one point in the negotiation to all the other African states saying, don't break ranks. We need to act together. Don't give in to pressure. And I think that was really significant to see. So Fatima, I want to come back to you to talk a bit about the very current moment. You alluded to this when you talked about your last structural factor around leadership. My small editorial comment before I ask my question, because I can't resist, is we seem to be in a world that's not even so much about friend and foe or US versus China, but it's the strong versus the weak, right? And the strong are really trying to leverage their strength. So it's a current moment of a particular kind. And it's a moment as well in which the funding cuts of the US administration, but also, as it was reminded to us this morning, also a number of Western countries who are investing now in defense spending. And the impact of those funding cuts are really severe. Can you give us a sense of the kind of crisis that this is creating and what the impact is at the local level around public health, but also in particular public health emergencies?
Thanks. So a few points on that. The first is that I can't believe we're in 2025 and we're still negotiating an annexure to a pandemic agreement when the COVID pandemic hit us in 2020. And it's not just the 45,000 deaths in New York, millions of people died, the mobility, $1 trillion in economic loss. I mean, a negative experience living through the COVID pandemic, but I mean, it was devastating. We're still negotiating. And we're still negotiating because that's a deliberate strategy, I think, of many northern countries and particularly the pharmaceutical industry. I mean, Nina may have alluded to this, but one of the significant delays in trying to get that annexure was the pharmaceutical sector, who wanted the data, but in return for nothing. They would still keep a stranglehold on IP. They would still want, 20-year minimum patent guarantees, being able to evergreen after that. So I think what I'm trying to stress is that we are in a real crisis, because I think the seriousness with which we need global leaders as well as multilateral institutions to take pandemic preparedness is not necessarily there. And I think we saw this, how it's played out in the negotiations and also in this continued negotiations around the annexure. I think it's interesting that Cyril Ramaphosa, the president of South Africa, has been writing all these letters around global solidarity, not breaking ranks. I think that's significant because we are in a moment of crisis where the US administration, the new one particularly, for the last year, at least countries, particularly countries in Africa, and of course, mainly South Africa, because of an administration that wants certain things. Now, this is not new. We've seen this in HIV/AIDS, we've seen this in COVID, we've seen the bullying, we've seen the manipulative behavior. I think it's just at a level where the only way I can describe it is that it's on steroids. So the current reality of the funding cuts in Africa is so complex to unpack in a few minutes. I'll just try and give you a high-level summary version. It started out as absolute chaos and crisis because of the abrupt cuts and adjustments, to the point where certain countries in Africa actually basically were at risk of losing their entire public healthcare system because they were so dependent on PEPFAR, USAID, CDC funding. There were other countries that were less dependent, some who were very dependent on research data. So it's quite a mix of the way in which it's played out. Towards the end of last year, you saw what's called this America First Global Health Strategy. For those of you studying public health, you have to read the strategy and study it to understand the dangers that we face and the crisis that we're in, and the way in which the US administration under Trump is positioning itself in terms of trying to re-emerge as this global health leader with certain demands and with certain non-negotiables. So it's an America First strategy in his vision, in his mind, with the local ramifications of elimination of funding for sex workers, health rights for men who have sex with men, for trans people in particular. And so, a limited offer of support for only pregnant women and for some of the things that are considered not controversial. No termination of pregnancy services. But what happened towards the end of last year with certain African countries, they did break ranks. And so they have broken ranks. And I think that's the current situation we're dealing with in Africa, is that the US came in with these bilateral agreements and bilateral trade agreements with health funding. So if you allow the US to have a military base in your country, if you allow yourself to take in prisoners that the US are sending over to your country, that you have to incarcerate at your cost, then you will receive certain levels of funding for health services to continue or to restart or to be reinitiated, particularly for HIV prevention and treatment. Some countries have said no. Some countries haven't even been offered that, but some countries have actually signed these very pernicious bilateral trade agreements. But it's what Biden did with the TRIPS waiver under COVID. It was bullying. Catherine Tai, you'll remember, came in and said, well, we'll only agree on a waiver if it's limited to vaccines for a limited time period. That's what caused the entire sort of crisis around the global South-led demand for a temporary waiver during the pandemic. I, as a human rights lawyer, can tell you, I don't think we'll ever get a waiver in the next pandemic or the next global health outbreak, because the forces that are at play are not going to allow that. We saw the way in which the industry responded to the waiver in Geneva, and I'm really glad that Nina mentioned this point about Geneva sort of becoming the epicenter of power around global health, because that's where the industry really pumped in a lot of funding to lobby against the waiver, and that's where global North governments and their delegations were blocking the waiver as well. Let me stop there, because I think it will be interesting to get other perspectives. But bottom line, the reality on the ground is that most African countries cannot self-fund, are scrambling to find additional resources to fill the gap. And in many cases, the US decision to cut funding has been a very punitive one for countries' international foreign policy positions, or because they're not agreeing on handing over minerals and resources. So the geopolitics of the US administration's position on global health for Americans first, and the way in which they're extracting concessions from really desperate, debt-ridden African countries, I think is interesting to play out and something to watch over the next few months. Thanks.
Thanks, Fatima. So you've painted a picture for us that this is not collective action through multilateralism. This is bilateral asymmetric use of power. We've seen this before. We're seeing it in a particular form in 2025 and 2026. I'm going to go to Nina for some last comments and end with Roojin, but then we will have time for some of your questions, so get ready. Nina, would love your quick take on how the administration and geopolitics are affecting cooperation on pandemic preparedness and response. But really, maybe you can be the slight voice of hope here. You've made the case that while finalizing PABs and treaty ratification matter, we need to start trying to operationalize the treaty now. So what would be some of the priorities here that you would want us to take away and think about?
Yeah, I'll start with that. And to Fatima, we're really, those America First MOU treaties, they are extractive. We're giving a very little amount of aid as a country, and we're asking for pathogen access and benefit. We're asking for pathogen access for 25 years. So let's just call it an extractive agreement. So on the positive, there's a lot that countries can do, and I think that's where we all need to get in gear and start to push. So on the local level, got to prepare for the ratification process. It takes time. That means letting people know what the treaty is, letting people know how it differs from the IHR, explaining why it's important. Every country in the pandemic agreement, which I highly recommend everybody read. It's quite a long document, but there's planning you need to do, multi-sectoral planning, budgeting, surveillance, getting your labs up to speed. There are all these action items that countries will need to do as part of the process. And when the country is agreed by, when the treaty is agreed by 60 countries, it goes into force. And 60 really isn't that much. It's only a third. So a country like Canada could be a leader, and pretty much any country can continue with these things. And then at the global level, there are also things to do. WHO has a lot of roles, and I think that's a little bit of a worrying part of it, because they've been felled by the pullout of the US from their financing, and they have a secretariat, and they need to prepare this thing called the Conference of Parties, which is similar to the climate COP, but it'll be the pandemic treaty COP, and they prepare the rules of procedures, the accountability measures. WHO has some responsibilities within the treaty, like a supply chain network. So there's lots of things that could and should be happening as in parallel to the PABs negotiations.
So maybe this is part of filling out our Prime Minister's Davos speech, a kind of to-do list for middle powers to kind of kickstart.
And just to say that, with only 60, that is that's a doable number.
That's doable. That's a target that you can actually achieve.
Canada first.
Yeah, Canada first. Well, yes, interesting. Except, Roojin, let's bring this back closer to home.
Sure.
There may be some in the audience who aren't up to speed on the Canadian context for the IHR amendments, and specifically that Canada has rejected those, at least temporarily. Mm-hmm. So can you say more about the reasons for that, some of the politics behind it, and then I'm turning to you for questions, because we will have probably 10 minutes, something like that, for questions.
Sure. So I'll try to be really brief, because I would like to get to the questions as well. But yes, as you said, we issued rejections to the amendments. You'll recall that as a subscription international treaty, you have a set period of time to issue rejections, and Canada did so within the time that it had. The reasoning it's giving is that we need to get our ducks in a row. We need to align our domestic, provincial, territorial, federal systems. We need to make sure all of this is in line, and we need to go through a formal tabling process in Parliament. Now, as someone who teaches constitutional law, I don't think that is correct necessarily. We have our treaty making is it's a royal prerogative. It's within the executive branch of government. Our federal government could sign on to treaties if it wanted to. And also the international health regulations, being what it is an opt-out instrument. So actually, it has a different operation. It is not a treaty that you sign on to. It's a treaty that you don't say no to, or if you say no to, then you're not bound by it. Anyway, all that to say that we should be joining eventually. I am not part of the discussions. I don't know at the bottom of it why we decided to go through a policy of tabling treaties as opposed to following the royal prerogative. What I think is happening is there's actually a very strong misinformation campaign going on about the international health regulations at a domestic level. Even some of our members of parliament are going and writing blogs almost on a weekly basis, talking about how Canada should be withdrawing from the UN, Canada should be withdrawing from WHO, etc. This is not fringe stuff, it's happening in parliament. And so I think we need to see that context as maybe the underlying reason for which a tabling process it's happening, as opposed to an automatic acceding.
So this is fascinating, and it speaks to one of the project priorities for PERL, right, around mis and disinformation, and particularly around parliamentarians who may not have the expertise in this area, what they're hearing. It reminds me a little bit about what was going on during the pandemic treaty in the United States, right, among US politicians who had a particular view of what was in the pandemic treaty presented to them and were writing letters to Biden, were writing letters essentially encouraging the US to hold back. So there's some similar dynamics here. Let me go to the audience to see if there are any. There looks like there's lots of questions. Okay, good. Mostly at the back so far. So let's take some of those. The microphones are coming. Thank you very much to Fatima, Roojin, and Nina for giving us such a big smorgasbord on the table here of different issues we can pick up on. Yes, please go ahead first.
Hi, can you hear me okay?
Yep, we can.
I just want to ask a question and maybe take us into a little bit of a different scope, but since you're all on the panel, might as well. And kind of hint at the previous panel. The previous panel spoke a little bit about trust and how some of the responses, all of the responses are really a political move and I guess in some ways related to power and structures. And you speak on this panel a lot about what countries can do. And I'm a little bit more curious about perhaps shifting the power a little bit down and kind of trying to figure out what it is that people can do, I guess, in a community-based setting to encourage that trust, not only within the community itself, but also trust within the higher structure of power. Like, how can we try to rebuild trust within our governments, all of that, and each other to feel better prepared? Because I think again, I'm sorry about the bad names and the memories, but the person that spoke at the very, very, very beginning said something after the last panel, is that a lot of us were the reason why businesses failed and businesses tanked because we didn't go out. So I guess I'm just kind of reclaiming a little bit of the responsibility of what it means to be prepared as a globe for the next pandemic.
Thank you for that question, and maybe would you like to start, Nina and Roojin? It's interesting because I think a lot of times, and I try to tell my students this in courses I teach on global politics, that even if you have an international treaty, it has to be implemented for it to really come alive, right? And so where does implementation take place? At multiple levels, including down to the very local. So your question is bang on, really, in terms of where it encourages us to focus. Do you want to start, Nina?
Yeah, sorry. Yeah, one thing I'd like to say is the pandemic treaty, Mike talked about death threats. I mean, I got death threats for the pandemic treaty, as if like anybody really cares about the pandemic treaty. It was fascinating.
Wow.
Yeah, like get out, and it's this sort of idea of WHO, get out of our living rooms, government, get out of our living rooms. So that was kind of the nature of it, although it wasn't quite that polite in the way it was phrased. But I think on the pandemic treaty, one of the things, I'm not going to bring it all the way, I'm going to bring it down to civil society. Because one of the big mistakes that governments at WHO made for the pandemic treaty negotiations was they kept civil society out of the room. We literally, and there's a gentleman in here shout out, that we sat in the cafeteria together. We weren't allowed in the room. For the PABS negotiations, we're totally not allowed in the room. And what we tried to say to them was, not only can we play a constructive role in helping negotiate, because we know lots of these people, we've been working with them forever, but also we're the ones who are going to communicate out what this is about. And so you're going to get a piece of paper at the World Health Assembly, and then it goes back to all of our countries to ratify, and nobody has heard of it or knows what's in it. So whatever that phrase is, you're cutting your nose to spite your face, whatever that means, something like that. But so that was a big deal. And I think we still need to push hard our governments, and I know it goes back to governments, to let us into the dialogue and let us into the negotiation. Because unless we know what these things are in this room and can be advocates, we can't build the trust to make them happen.
Fatima, maybe I'll go to you next and to Roojin. I mean, in a sense, you hinted at how difficult it is in the context of Africa where state capacity is so fragile. So you look at local communities as being a source of solutions all the time. But I wonder if you have thoughts on the question about moving this down a level from member states or governments to closer to individuals and where they live.
So, I mean, I can just echo what Nina says. Unfortunately, it's member states that get to negotiate. They don't necessarily get a mandate from us. They're not necessarily democratic and accountable to us, even in the global south, to tell us what's happening in Geneva. That was one of the problems with the TRIPS waiver negotiations. So you'll all remember how we were excluded from that process. They were having secret green meeting rooms. So there's so much of mistrust, both from right-wing forces as well as what I would call left-wing forces and sort of pro-science communities. We saw this in the AIDS crisis as well. Yes, we can try and put more efforts into movement building, but I think that there's such negative and pernicious forces at the moment, even throughout Africa, that's trying to discredit the CDC, the NIH, the WHO, all of UN bodies, but will respect sort of the WTO. On the left, right, because of what we experience in HIV/AIDS and what we experience in COVID, there's just very little trust in global north governments, in multilateral institutions, and there's no trust in the WTO. So I think this is why I'm saying we're in a really dangerous moment, which is being fueled, unfortunately, by the Trump administration. It was there before, but I think it's definitely being fueled by that. And so, I mean, is there a way in which younger people, in which younger researchers can try and lift up what I would think are the main elements? I mean, I'm less interested in the WHO and its bureaucracy, but the WHO serves an important purpose around science. Is how do we get a pro-science, pro-evidence, pro-proper information agenda on the table? And I mean, really worried to hear that Canadian MPs are falling for this. I mean, this is exactly what's happening in parts of Africa where groups from the US are coming in to basically discredit some of the key processes that are playing out and discredit the WHO. And this idea that the WHO is going to come and declare another pandemic and take over the sovereignty of countries is one of the myths that's being perpetuated. But the other is just these really well-funded groups that are coming into Africa and basically discrediting really, key medical and technological tools that could protect a woman from an unsafe abortion. Simple things like termination of pregnancy, which is becoming sort of at the heart of this sort of anti-science crusade. We saw a bit of this in the HIV/AIDS movement. We called it quackery, where people would say that HIV didn't exist, or didn't cause AIDS, or you shouldn't use ARVs. And it was communities that built social movements that basically turned the tide on that. And so I don't think, you can underemphasize the importance and the value of that. But yeah, I'm really worried. So I don't think things are looking good.
Even though you're not with us, we can feel that. We can feel your worry. I'm going to take two questions, and I'll come to you, Roojin, after that, just to make sure we hear a few. So there's a gentleman right here, and then someone with the microphone at the back. I'll take two lots of two, and then I think, unfortunately, we might be done. But please go ahead.
Hi, Roojin. Thanks, Nina, Roojin, and Fatima. this is a where do we go from here question, so I'm just going to phrase it. So we have Africa CDC, we're trying to drum up sort of solidarity in the African region, especially after Trump's sort of cruel policies. And we were kind of moving towards that, but now, as Fatima and everybody mentions, we have the America First Global Health Strategy, which is kind of driving a wedge into that because, you know, if you've signed with America, you're in a situation. And at the same time, we have the pathogen access and benefit sharing negotiations going, which is also impacted. So my question to three of you, perspective-based, because you all are immersed in this, where do we grow from here? Can we come to an agreement on the pandemic agreement and finalize the PABS? And how do we navigate this oncoming sort of polarization in global health, essentially led by America at this moment?
Okay, great. Hold your thought for a sec. Next question. Who's next? Yes, please.
Thank you so much for a great presentation. And my question is about, when we observe the gap between the global north and the global south, in terms of access to biomedical equipment, in terms of access to medicines, in terms of access to technology, and we are trying to push for signing like treaties. And at the same time, we observe that the political economy in terms of, is still moving forward to profit motive in terms of, you know, getting in the World Trade Organization, you know, still trying to, you know, to put the rules in terms of, you know, having access to those things is really expensive for the global south. And the gap in terms of social justice and equity to access to those things is still huge. Why we should try to keep signing treaty and without having really some, you know, real result in terms of access to those things?
So where should we be directing our efforts to kind of the core of the problem? Let me start with Roojin first, and then Nina, and then I'll come to Fatima. Please feel free to answer, elaborate on whatever you'd like.
Well, yeah, so I mean, I think just going on the question of where do we go from here, I think both were really excellent questions that require dissertations to really unpack. But in terms of where we go from here, I mean, one of the things that is interesting about the US not being in the room of the negotiations is that it actually seems to be helping negotiations progress more quickly, right? I mean, so there's things that are good about it, and there's things that are bad about it. There's dualities about this. And I'm probably one of the people with a very unpopular opinion that I think that this thing that we're seeing in the world happening today with the retreat of the United States and also certain bilateral approaches happening is kind of lifting a blanket from our eyes, and we're seeing things for really what they are, right? We're seeing sort of a world that was dependent on one or singular powers, right? And that's uncomfortable, and that's painful, and that's hurtful, and that's causing death. But it's also causing truth to be revealed to us all. And so I don't know, but I think that humanity is creative. I think we're going to find ways to resolve, to move away from this. It might take 10 years, and not immediately, but we're going to find ways to move through it. I see it as a half-full situation still. And then I guess on the question of why treaties, I'm a constructivist, so my approach is to think that norms and rules matter, discourse matters, and I think that is the real power of the pandemic agreement. It's that it's creating an idea, even if it's not even if it doesn't become operational, because we never get a PABS, it's written on paper, and as I think Nina said this excellently, we can still implement things, even as it's not a law. I mean, what is law anyway, right? As a lawyer, we'll put that question to you. Anyway, I'll stop there because it's going to get too philosophical. Yeah.
I need to hang out with her more because she kind of gives you this half full, right, perspective. Yeah. This is excellent. Yes, that it's about having the norms there that then create expectations and actually start to build capacity, right? Nina.
I'm just going to give 2 thumbs up, as if we were on Zoom, to your answers.
Yeah. Okay, Fatma, I'm going to go to you. And I think I might have to leave it there.
Yeah, just a quick thing. I think the one advantage of the US basically withdrawing from every kind of credible body and every kind of credible system is that it makes it embarrassing for other countries then to do the same. So one of the things about what is happening is that if you want to separate yourself from the madness of the US administration, whether you're Canada or New Zealand or Australia, and everybody's been, on the receiving end of the Trump kind of demands, or in African countries, it's the irony is that this you're either with us or against us has been flipped, right? And right now it's just too embarrassing to be with the US on a number of these key processes and treaties. So I think, I agree. You implement as much as you can. We're all not naive. We know that there's not going to be total respect and observance, but you try and get what you can. None of us thought that the public health declaration on COVID would help, but in certain cases it did. Not fully, but we'll wait for the glass half full. Just the point about somebody talking about the profit seeking and the commodification and the monopolies, I think that work still has to continue, with or without the US in any of these forums. Our work as civil society has to continue. We have to continue pulling out the critiques of this absurd WTO system that keeps patenting life-saving medicines because Pfizer wanted that, because the pharmaceutical industry wanted that about 25 years ago. That has to go. And I think that this is the perfect moment. While the US is sort of unraveling, we need to try and, do as much advocacy as we can and try and make as much change as possible, because that administration will be replaced one day. That's not a permanent thing. And when they do, we need to have a set of norms and rules that we can then at least try and enforce and try and implement. I'm not saying that it will work, but I'm saying that is important for us to have some kind of certainty going down the next 25, 30 years.
I'm afraid I can't take any more questions. Sorry to those of you I didn't get to, but we want to stay on track because there's fantastic panels coming up. This has been a wonderful discussion with three incredibly wise and committed and generous colleagues. Can you please join me in thanking them? And Fatma, we wish you were here, but stay safe, stay well.
Thank you. Keep well.